So I would like to thank the organizers for the smooth organization of the workshop and for certainly kind of organizing this very timely event. And I also would like to thank them to actually impose strict deadlines on drafts of papers. So this forced me to put on paper some thoughts of that have been brewing over last couple of years. Actually, for a couple of years, I've been working on the issue of access to information as part of a larger project looking at how to promote the integrity of clinical research practices and also how to promote the integrity of pharmaceutical product development. One of the things that have always stuck to me is the idea that we do emphasize in the right to health literature quite extensively the importance of access to medicines, but there is not the same kind of emphasis on the importance of the access to information, and more particularly the access to information about the effectiveness and safety of pharmaceutical products. It's understandable, it's not yet as of a kind of a core issue in the context of, for example, the developing world, but it certainly is kind of a major public health issue in the industrialized world where we have a public health crisis, you could say so, around the overconsumption of medication, the use of unsafe and ineffective medication, withdrawal from the markets that we've seen and that I'll briefly discuss. It's certainly also becoming a global issue because of the nature of research, the nature of data gathering, which will actually be discussed by one of my colleagues later, the nature of research becoming more and more international. And so also the measures that are needed are increasingly global and have to be addressed from that perspective. And I would say if we don't address or if we don't find a better way to promote access to information, we will in the developing world face the same kind of, and to a more staggering degree, the same problems that we already have in the industrialized world. So in that context, if you conduct research kind of looking at the issue of trial registration and results reporting, I'm an advisory board member of a committee of the Pan American Health Organization, which as part of the WHO effort has trying to promote access to information through trial registration and results reporting. And we've been struck there by the argument from some members on the committee, particularly I remember a Chilean member arguing actually that his government could not commit to trial registration and results reporting because of international trade agreements. So this is basically the issue that I want to discuss here. How can we argue that access to reliable information about safety and effectiveness of medication can be seen as a component, an essential component of the right to health, which should trump